Hello, everyone, and welcome to our forum webinar. Today's topic is medication as a tool for successful weight loss. My name is Dr. Lauren Lemieux, and I'm a physician at Forum. I'm board certified in internal medicine, obesity medicine, and as a physician nutrition specialist. And I'm joined today by Julia Axelbaum, who's our director of nutrition at Forum, and she's also board certified in obesity and weight management. Just a few announcements before we get started. We do encourage you all to participate and ask questions by using the chat feature in Zoom. And keep in mind your participation is completely anonymous. And we will be recording today's session, and you'll receive a link to the recording afterwards. So with that, let's get started. Today, we're going to first start off by talking about why weight loss can be so challenging for so many of us. We'll review the effective weight loss tools that are based in science, and specifically be spending most of our time talking about the FDA-approved medications for weight loss, as I know people have a lot of questions about those. Research has shown that our body weight regulation is not entirely under our voluntary control. In fact, there are numerous biologic, genetic, environmental factors that affect our weight balance. Therefore, it's important that we try to identify and address these factors in order to achieve healthy weight in a manner that's not just effective, but also sustainable. And studies have shown that in the process of losing weight, your body responds with compensatory changes like a slowing of your metabolism, an increase in the hormones that make us hungry, a decrease in the hormones that keep us full. And that's why it can make it really easy to regain weight. And in fact, it can almost feel like a tug of war where you feel like you're doing everything right, trying to eat well, move more, but there's just something pulling you back to where you came from. And I highlight this concept for two reasons. The first is to recognize that it's really our own biology, not something we have a lot of control over, that plays a significant role in why weight loss can be so challenging. And second, when we think about medications for weight loss, these primarily work by reducing appetite, and therefore help not just with the process of losing weight, but also weight maintenance, in a sense, opposing some of these natural signals that promote weight regain. So what really works for weight loss? Research has shown that nutrition, physical activity, and mindset shifts are some of the key foundational tools for weight loss success. Now, I do acknowledge, though, that implementing them or maintaining them long-term can be challenging. And so that's where working with the support of a professional can really help. For example, when it comes to nutrition, there's just so many different diets out there, and people feel confused, overwhelmed, or even downright frustrated when just trying to figure out what to do. And so when Julia, a registered dietitian, is working with her patients, she really assesses their nutritional needs and preferences to develop this personalized plan that's sustainable and enjoyable for her patients. And ultimately, research has shown that it's that sustainability of any dietary pattern that's going to be most likely to be successful for long-term weight loss and weight maintenance. Now, I do want to acknowledge that many of you listening today may have already tried some of these foundational tools in the past, possibly multiple times, and still struggle even with support. And so in that situation, that's where we might consider some additional treatment options like medications or surgery. But keep in mind, these should always be thought of in conjunction with the foundational tools of nutrition, physical activity, and lifestyle changes, because that's ultimately how science has shown them to be effective. And this study illustrates this point very nicely. In it, they took groups of people, one group that received medication alone for weight loss, another group that had lifestyle counseling alone, and then combinations of medication plus brief lifestyle counseling or intensive lifestyle counseling. And what you can see here is that that combination of medication and intensive lifestyle counseling led to the most weight loss overall. In fact, 2.5 times more weight loss than just medications alone. And that's why at Forum Health, we really emphasize the importance of these lifestyle changes and potentially offer medications for patients who are considered eligible candidates. Now, I do want to point out this is an older study, and in fact, the medication that was used in the study is no longer on the market, but similar studies have shown similar results. For example, in this study here of liraglutide or Saxenda, a medication that's currently FDA approved for weight loss and still on the market, They took groups of participants and all received intensive behavioral therapy. However, one group received a placebo, that's something that has no therapeutic effect, and the other group received the medication liraglutide or Saxenda. You can see here with just the intensive behavioral therapy, patients did lose weight. And at about over a year, they were down 4% of their starting body weight. However, combining the lifestyle change plus medication, our dark blue line here, we found even more weight loss over a year. So a patient may be considered a candidate for weight loss medication if they've been unable to lose or maintain the weight that they've lost with just lifestyle changes alone. Furthermore, it's recommended for a person to have a body mass index or BMI of 30 or higher, or 27 or higher with a weight-related medical condition. And that can include things like high cholesterol, high blood pressure, diabetes, or sleep apnea. And if you're wondering for yourself what your BMI or body mass index is, there's a number of free online calculators where you just enter in your height and weight and it'll give you that number. And then finally, candidates for weight loss medications understand that they should be using this medication in combination with the lifestyle changes of a low calorie diet and increased physical activity. So here I have a list of the current FDA-approved medications for weight loss. They include our GLP-1 receptor agonist, liraglutide or Saxenda, and semaglutide or Wegovy, naltrexone bupropion or Contrave, phentermine, which goes by the names of Adipex-P or Lomera, phentermine topiramate or Qsymia, Orlistat, which is Xenical by prescription and Ally over the counter, and Plenity. And you'll also note some asterisks here. This is just to point out that phentermine is a controlled substance, so it's actually not prescribed by our providers at Form. And then Plenity is technically classified as a medical device, not a medication. So how do they work? Essentially, the majority of them work by decreasing appetite and cravings. And the GLP-1 receptor agonists also have the added effect of slowing down digestion. You can imagine if food is sitting there longer, you're going to feel more full. Orlistat does not actually act on the brain to decrease appetite or cravings. What it does is it blocks the absorption of fat from foods. So essentially, you're getting fewer calories from the fat in the diet. And then Plenity works by creating a fibrous gel when combined with water to physically take up space in the stomach. It occupies about a quarter of the stomach volume, so then a person will physically eat less at a meal because they're already partially full. I also think it's important to point out what medications do not do. So medications do not significantly rev up your metabolism, where now you're burning an extra 500 calories a day that you weren't otherwise. And they definitely do not replace healthy nutrition and physical activity, both of which have numerous health benefits that extend beyond anything of just a number on a scale or losing weight. And then keep in mind, they're not going to address underlying life stressors that may be affecting your weight, and they do not work for everyone. And I talk to my patients about how, there's no crystal ball or blood test that I can use to say, oh, this is the medication that's going to work for you. In some cases, it is a chance for us to try different things and see what works best for that individual. And I also point out that there is the potential for regaining weight after stopping these medications. And this is highlighted very nicely in this study of semaglutide 2.4 milligrams or Wegovy. So this gray line here is representing patients who are treated with a placebo. Again, that's a substance that has no therapeutic effect. And the dark blue line is the patients who are taking the medication semaglutide or Wegovy. Now, also keep in mind that all patients in this study were engaged in lifestyle counseling to help them follow a low-calorie diet and increase their physical activity. And so just paying attention here to that blue line, you can see that over time, they're losing weight. In a little over a year, 68 weeks, they're actually down about 17% of their starting body weight. But at the 68-week mark is when they then stop the medication. And you can see quite dramatically the weight is starting to come up. And after about a year, they've regained about 2/3 of the weight that they had lost. And I think this really highlights just how important it is to think about treating weight as a chronic medical condition and understanding that these medications are not a quick fix and not something that we use short term. Now, on the left are our FDA-approved medications for weight loss that I have reviewed, but on the right, I have some additional FDA-approved medications that can promote weight loss. These include other GLP-1 receptor agonists like semaglutide in the form of Ozempic or Rybelsus. There's metformin, naltrexone, tirzepatide or Mounjaro, topiramate or Topamax, and zonisamide. And so when might we use a medication on the right and not one on the left? Well, let's say, for example, a patient is a great candidate for Wegovy, but it's not covered by their insurance. In that instance, their doctor may think that it is appropriate to use Ozempic, which is the same active ingredient as what's in Wegovy, as it may be covered by that patient's insurance. Now, a lot of patients want to know, how much weight can I actually expect to lose with these medications? And so what I can report is the average weight loss from clinical trials. And so for most medications on the market, you're looking at about 5 to 10% body weight loss. However, one of the newer medications, Wegovy or semaglutide 2.4 milligrams, showed an impressive 15% body weight loss on average in their clinical trials. And then an even newer medication, tirzepatide or Mounjaro, showed in a weight loss study about 21% body weight loss on average. Now, I do want to point out Mounjaro is currently FDA approved for type 2 diabetes, not for weight loss, though it is being fast-tracked by the FDA for this purpose. Now, how does a doctor choose the medication for a patient? It really takes careful consideration of your own medical history, whether there's contraindications to taking these medications or potential drug interactions with medications you may already be taking. What are the different side effects of the medications? And of course, for each medication class, it is different. And how likely is it for you to tolerate those side effects? Or do you have other medical conditions that may make it more favorable to try something different in that instance? Additionally, I'll point out that sometimes as doctors, we're looking for maybe a twofold effect. So what I mean by that is, let's take this medication Contrave, which contains bupropion and naltrexone. It turns out bupropion is also used just by itself as an antidepressant medication and a medication to help people quit smoking. So if you're trying to lose weight and you're also trying to quit smoking, perhaps your doctor may be more inclined to start with this medication as a potential option. It really can be helpful to work with a doctor who specializes in weight management, like myself and my colleagues at Forum, as we have experience prescribing and managing these medications, and other providers may not have that same expertise. But I do want to highlight that this is just not a matter of filling out a questionnaire or texting a provider what you want. We really want to approach this in a manner that's going to be safe for patients as well as effective. So that brings me to our approach at Forum. As a patient at Forum, you're paired with an expert doctor who's board certified in obesity medicine and a registered dietitian experienced in weight management. And we utilize these important foundation tools of nutrition, physical activity, and mindset shifts, and if appropriate, medications. Our weight loss program is unique in that you're working one-on-one with these providers who get to know you and help you develop this personalized plan for nutrition and lifestyle change that's tailored to your needs. Your doctor is going to be carefully considering your medical history and utilize evidence-based treatments with the goal of successful and sustained weight loss to improve your health. And as I've already said, medications for weight loss are not a quick fix. They must be used in conjunction with these important foundational tools. And that's where we give you the resources to actually implement them. So some of the things that we have include our app, which allows you to do weight tracking and food logging. And research has shown these types of tools that provide accountability and reflection can be very helpful for helping patients lose more weight. Furthermore, we utilize the app for you to communicate with your team, and everything is done virtually. So your visits with your doctor and dietitian are done from your phone or computer through Zoom. And I want to highlight that in terms of support, you're meeting with your doctor about every 4 weeks and the dietitian every 2 weeks, which is truly an exceptional level of support. Now, if you have more questions about our program, feel free to write them in the chat, and we'll take some time to answer those in just a couple minutes. And I do want to leave you with this, in that our patients at Forum after a year have lost on average about 15% of their starting body weight. And that really highlights just how effective and sustainable our program is. So I want to thank you all so much for your time and attention. And Julia is going to come back in for us to answer some of the questions that have come up through this talk. I'll just briefly mention that for more information, you can go to our website, www.formhealth.co, and that's also where you can go if you're interested in signing up.
Great. Thank you so much, Dr. Lemieux, for that informative presentation. We did get some good questions coming in, and definitely keep them coming. So let's see. First question is, when you showed the slide with the graph of the lifestyle change alone versus lifestyle change with medication, someone wanted to know why that medication that you mentioned was taken off the market.
Oh, so that medication was sibutramine, and I believe there were some cardiovascular side effects that were deemed not safe for patients to continue to use. And sometimes what happens with medications is, in order to get FDA approved, they go through clinical trials, we monitor for any adverse effects, but once it becomes more widely used in the greater population for longer periods of time, that's where these kind of side effects, unfortunately may present themselves. And that's why it was taken off of the market.
Someone asked, do you think Ozempic or Wegovy would be a good option for someone who is not diabetic?
So Wegovy is FDA approved for weight loss. So someone who has a BMI of 27 or higher with a weight-related medical condition or 30 or higher, and again, has tried to lose weight before, they may be a great candidate for that medication. What I will say is, unfortunately, many insurance companies do not cover weight loss medications, including Wegovy. And so as doctors, we're trying to do the best we can for our patients and get them the best treatment. And so if I were to feel Wegovy is the best medication for my patient and it's not covered by insurance, then I might look into seeing, well, can we get Ozempic covered? Even though if that person does not have diabetes, it would be considered off-label. But unfortunately, it can sometimes be down to insurance coverage for what medication options we have.
Well, along those lines, we have a lot of questions about cost, recognizing that a lot of these medications are very expensive. Questions about, will insurance cover these? Are people still able to get these medications given the shortages?
Sure. Okay. I'll just kind of add a few comments there. And if there's other more specific questions, Julia, just feel free to add them in as well. So when it comes to coverage of medications, it is going to be insurance plan dependent. And it's not just, do you have Anthem? Do you have this? It's what is the plan that was selected by, usually your employer? What are the benefits in your plan? And so you can, call member services and find out if weight loss medications or what are called anti-obesity medications are a covered benefit or if they're considered a plan exclusion. That's helpful information. The other thing is, there are, in some cases, similar medications that are available as generics. For example, if you have Contrave, which is bupropion and naltrexone, a doctor may prescribe bupropion and naltrexone separately, which would be off-label for weight loss, but essentially to approximate the same medication or the same components that's in Contrave. So there are some ways that we as doctors try to help patients navigate this where, it doesn't necessarily have to be that name brand medication, which can be extremely expensive. Some companies do offer some savings coupons, some are better than others. It just depends on which one we're talking about and, which diagnosis is associated with the medication. And then when it comes to the shortages, so Wegovy for the last almost year and a half was just completely unavailable to starting for new patients. There were some issues with manufacturing and supply, and essentially they took it off the market until they could reliably have that supply available. As of January, it's back in pharmacies, and so patients are getting started on it again. But unfortunately, more recently, Ozempic has faced some shortages because Wegovy was not available. Ozempic contains the same active ingredient, and so many people were using that medication in lieu of Wegovy. And then another comment is just with Mounjaro, which is a new medication that came out for diabetes. We know it has significant potential weight loss benefits for patients, and so that medication was used a lot more than I think the manufacturers were anticipating, and so there were some shortages there. But I think all of this just highlights that there is such a need for effective treatment options for weight. And, hopefully that, drug companies, our government is getting the message that this is something that we need to address for patients. But that's a much longer discussion than I think we have time for today.
This question I think is very interesting. Someone asked, even if your insurance will cover the medication when your BMI, your body mass index, is above 30, when you lose the weight, if you get your body mass index into a healthy range, is that something that you can continue with the medication? Do you know if insurance continues to cover it?
There are potential nuanced ways that your doctor can help ensure that it gets covered. By that, I mean how they're submitting the prescription, what body mass index they're coding with that. And then, yes, unfortunately, some insurance companies say, look, you're no longer in that weight category. We're not going to cover it. And so oftentimes that does take, the advocacy from the doctor, and, hopefully there is some logic behind them understanding why we advocate for the long-term use of these medications. And in some cases, we've been able to, get that patient to continue on the medication. In other cases, sometimes we have to switch to something different. And again, unfortunately, we're at the mercy of what may be covered and cost in some cases. But, the doctors at Form, myself included, I mean, we really go to bat for our patients to try to get them the best and most effective treatment for them.
Yeah, I think that's such a good point. And it's really something I feel that makes the program unique, the way that the clinicians are really advocating for their patients. And I see hours spent calling up insurance companies, trying to help them understand how much this can help our patients. And then there's a question here, is there an upper age limit for medications?
So it's really up to the discretion of the doctor. There's no specific age limit for medications necessarily, but I will point out that just in general, weight loss medications are not well studied in patients typically over the age of 70. But again, it is a shared decision that you and your doctor make in terms of, do we use a medication, which one do we use, and what's going to be safest for the patient. And then I'm so sorry, just to jump back. So there's been a lot of talk about medications, how expensive they are, and whether or not insurance covers it. And I wanted to highlight that, unfortunately, we don't have this published, but from our own internal data, what we've seen here at Form is that even if our patients are on, some of the less expensive medications, let's say metformin, for example, they're actually losing more weight than what we see in some of the published studies. So with metformin, maybe you see 3 to 5% weight loss. Our patients maybe lose about 10% of their body weight. And so that's really impressive in highlighting the strengths of our program, and also that it's not just about medication, it's the whole package that we really support our patients with.
Yes, and I can actually talk a little bit about the work that we're doing with patients beyond the medication. So I'll just take a minute to explain a little bit more about that. Every patient who joins Form Health is paired with an obesity medicine doctor and also a registered dietitian. All of our dietitians are specialized in the field of obesity and weight management. And we have an extremely high level of support where we're meeting with our patients every 2 weeks for virtual video visits, as well as unlimited texting in between these visits. So the first time we meet with our patient, it's a 60-minute initial consult, and we're spending time really understanding each person individually, their medical background, their background with diets, what's worked, what hasn't worked, what they're looking for, where their challenges lie. And every person is so unique. I always, when I explain the program to people, I'll say, like, there's no Form Health diet plan that I'm handing out to someone. It doesn't work like that. I think of it a lot more like meeting with a therapist, where you develop this really strong relationship with your therapist and you're meeting regularly. And what comes from the session is what comes from your discussion, and where those challenges are and what things you're really struggling with. So we, like I said, meet every 2 weeks. We're developing a completely individualized plan. There is no, specific diet that we require. We actually don't require calorie counting. Some people do very well with it, but a big focus for us is sustainability, finding a system that patients can see themselves sticking to for the rest of their lives. And so we really try to move away from all of the specific weighing and measuring and numbers into more of looking down at your plate and, using visualization techniques to understand, is this a weight loss meal? Is this something that's going to align well with my goals? And then there's some questions about kind of how we support patients longer term. And so just on that topic, I wanted to explain that we have a few different ways that we offer community support. So we have a private Facebook page, Facebook group for all Form Health members, where it's a really nice opportunity to talk through challenges and successes, ask questions to other people going through the same thing. We have monthly support groups that patients can join. And then in terms of kind of what the research shows for how to keep weight off long-term, we know that accountability is huge. So being able to continue to meet with your care team regularly for the long term, continuing to step on the scale regularly, continuing to track your food for the long term, those strategies work really well long term. And like I mentioned, we're finding strategies that you can see yourself doing for the rest of your life, right? We're never going to tell you to do something that only feels like a temporary fix, because then the weight loss will be temporary as well. So that is our whole focus, helping you maintain it in the long run.
Mm-hmm. And I'll also just add in, because I had a patient ask me this recently. No, we do not kick patients out when they've reached a healthy weight. You're with us, you're our patient. And so we really anticipate having a long-term relationship with our patients, because arguably that maintenance is, one of the hardest parts of all of this. It's one thing when you're losing weight and everyone's saying, wow, you look great. What are you doing? But nobody ever says, wow, you're really maintaining your weight. Like, right? You don't get that same sort of positive reinforcement. But, it's not just for that. It's also monitoring your health and us being part of your care team.
Yes. A patient here is asking, this patient is, or this attendee is post-bariatric surgery and was kind of asking for a little more about some of the guidelines that we're teaching. This is a good example of how the guidelines that we're giving you are going to be completely unique to your situation, as opposed to someone else who's not post-bariatric surgery. So like I mentioned, our dietitians are specifically specialized in this field. Many of our dietitians have worked in bariatric practices before, and we're going to completely individualize and customize the treatment plan to you and to what a diet post-bariatric surgery should look like.
Mm-hmm. And, all the doctors being American Board of Obesity Medicine certified, we have plenty of experience of working with patients who've had bariatric surgery. We're up on the literature of, what is the best practice in terms of weight regain after bariatric surgery. And then also, we often take it a step further in making sure, okay, are your vitamin levels doing well? Who's doing the screening for that? We will take that over if that's necessary, because we want to provide you that comprehensive care from the experts, as you may not have a relationship with your bariatric surgeon anymore because it's been so long. And oftentimes there isn't that longitudinal structure like we have built into our practice in a surgery setting.
Yes. Someone is asking about if we do low carb, if we do keto. So I could tell you I know we don't have a lot of time, but in terms of the specific diet that we're recommending, like Dr. Lemieux mentioned, we are using evidence-based, research-backed studies to make sure that we're only recommending anything that we recommend is safe and effective. Now, that being said, we are open to it all. We're open to finding a system that works for you. So I have some patients who, eat 3 meals a day, and we talk about, preparing those meals, and that works great for them. I have other patients who have really busy jobs that don't have the time or the desire to prepare 3 full healthy meals a day. And so they maybe use some protein shakes and protein bars. I have other patients who honestly, we don't even really talk that much about food, because for them, their struggle is actually more in the emotional eating and the cravings and the stress eating. And we really have to dig deeper to help them figure out how to tackle that because they know what to eat, right? That's not really where their problem lies. So completely customized, really. We are open to low carb if that's something that works for you, but not everyone is doing that.
Mm-hmm.
Okay, do we have, let's see, I guess we have one more that says, I have lipedema and it's very hard to lose weight. Many people have found help with Mounjaro. Is that something you would recommend?
Yeah. So lipedema, for those of you who aren't as familiar, is a condition where there can be excess accumulation of essentially fluid, usually in the lower extremities. And it can make someone have excess weight as a result. But that type of distribution of the tissue and the fat doesn't respond as well to traditional weight loss methods. And so it may help with some of the extra body weight that may be in the upper extremities and the belly. Lower down, it may require some additional, more targeted treatment with like physical therapy or a lipedema specialist, where they can offer some additional treatment options. But it's not to say that a medication like Mounjaro or weight loss medication won't help some of the features that may come along with that, but it's not a cure for lipedema.
Great. I actually think we got through all of them. There were some repeat, but I think we really hit on them all.
All right, great. Well, thank you all so much for your time and attention. And just wanted to point out again, our website here, www.formhealth.co. If you want to check it out, you have other questions or are interested in signing up. And I know I also speak for Julia when I say, it's just such a pleasure to have you join us today and to take time out of your busy day to learn about what we do and what we're so passionate about. And we really hope that we'll get to work with you in the future. So hope everyone has a wonderful day and take care.
Thank you so much. Bye.